I'm here to walk you through how and why our stem cells are effective. First, we're going to talk about inflammation. The reason you have inflammation in your knee joint is because there is something happening, most commonly known as osteoarthritis or degenerative arthritis, that causes inflammation. When you have inflammation, you start having pain. When you have pain at a cellular level, your body is sending stem cells that you have to the area of the body, which in this case is knee joint, to heal. But the problem is, at this age of 50, 60, 70, 80, 90 years old, you do not have as much stem cells as you had when you were a little kid, where you fell off a bicycle, you got up and you went on the bicycle again and you went your way. So you have a lot less stem cells now. And the stem cells that you have now, they're not as active. They're not as strong to duplicate and replicate and do their job like everything else in your body. So the first thing it does, it reduces inflammation. When? Immediately. Then what happens, one of the common characteristics of mesenchymal stem cells is mesenchymal stem cells are the stem cells that you get from umbilical cord tissue. You don't get it from fat or adipose, you don't get it from bone marrow. That's why we do not use them in this office. We use mesenchymal stem cells. Why? Because it works best for orthopedic conditions, specifically knee joint. Now, what happens when they're injected in the body? These cells, they are so smart that they become cartilage cells. If the joint needs cartilage, they become fat cells, they become bone cells, they become muscle cells, they become soft tissue cells. Many of you are suffering from meniscal tear, muscle tear. They become those cells because they don't have a DNA and they want to identify themselves within DNA. So they become these cells as the body instructs them that the body needs them to become, as the body wants to use them. And then they start duplicating and replicating. Not to mention the umbilical cord tissue stem cells, which are mesenchymal stem cells. They are from healthy C-section births of mothers who donate the umbilical cord tissue. What that means out of I think out of the statistics is out of 100 cells, there is one stem cell, versus out of 2 million cells at this age, you have one stem cells. So I hope this information was helpful. If you have any questions, please put it in the comments below. Feel free to share. Thank you.